everyone, so let's move towards our today's topic, which is
So let's move towards the topic that is submandibular gland and sublingual gland. Before starting the topic, you have to know that there are total three pairs of salivary glands in the human body, and one is parotid gland, another is submandibular gland, and the third one is sublingual gland. The parotid gland, the lecture of parotid gland has been uploaded, and now we will gonna talk about submandibular gland and sublingual gland. Now, these all salivary gland, the function of these salivary glands is to secrete the saliva, and saliva helps in the process of intaking the food and helps in digestion as well. Okay, now submandibular gland, it is the largest salivary gland, which is walnut in shape or J shape gland होता है ये, और ये कहाँ होता है? ये मौजूद होता है सबमैंडिबुलर फोसा में. Now where is submandibular fossa? Submandibular fossa is present posterior on the posterior surface, on the posterior side of the mandible. Okay, so on that side submandibular fossa is present. One more thing, submandibular gland is present in the digastric gland. Now digastric muscles forms a triangle by the help of muscles, and that is called as digastric triangle. Okay, now in that triangle submandibular fossa is present, and in the submandibular fossa submandibular gland is present. Now on that submandibular gland, mylohyoid muscle will pass, which divides the submandibular gland into two parts. The larger part is the superficial part, and the smaller part is the deep part. Okay, superficial part, first we will gonna talk about superficial part. It consists of three surfaces: inferior, lateral and medial. Lateral surface, obviously it consists of submandibular fossa and facial artery. Medial surface consists of styloglossus muscle and mylohyoid muscle, and inferior surface consists of skin, facial vein, facial nerve and platysma muscle. Okay, now if you see your face from the inferior side, or if you see the mandible, or if you see the submandibular gland from the inferior side, first you will see skin, then if you remove the skin, platysma, then if you remove the platysma, fascia, then after fascia, facial vein, facial nerve and facial vein, and then you will see the submandibular gland. Now if I talk about deep part, it consists of two ends, anterior end and the posterior end. Anterior end consists of sublingual gland, and posterior end consists of mylohyoid muscle. What is the blood supply of submandibular gland? Submandibular gland is supplied by facial artery, and the veins are facial vein and lingual vein. Okay, nerve supply is through submandibular ganglia. Now what is submandibular ganglia? Submandibular ganglia is parasympathetic ganglia, which is related to facial nerve and the lingual nerve. And if I talk about sensory fibers, so sensory fibers are bringing the sensory information to the submandibular ganglia by lingual nerve. Okay, and this submandibular ganglia forms some branches, and those branches are controlling the submandibular gland and as well as sublingual gland, which we will talk after this topic. One more point, as we know, there are lymphatics also present near the submandibular gland, which are called as submandibular lymph node. Now if the submandibular lymph nodes are affected, what happens? The submandibular gland should be surgically removed. Okay, so it is very much common. submandibular gland की removal submandibular gland का removal बहुत common होता है. Okay, and one more point, submandibular gland consists of a duct called as Wharton's duct or submandibular duct, which which opens into the floor of the mouth to release the saliva. So in that duct, it is very much common that stones will be appear. Okay, इट इज़ अ पैथोलॉजिकल बेसिकली पैथोलॉजी है बेसिकली कि स्टोन्स जो है सब मैंडिबुलर डक्ट में आ जाते हैं, जिसकी वजह से वो ब्लॉक हो जाती है और फिर उसको ऑब्वियसली रिमूव करना पड़ता है, जो प्रोसेस होता है वो करना पड़ता है. लेकिन दैट प्रोसेस दैट अफेक्टेड part is called as calculus. Okay, that means calculus is common in the submandibular duct. Now moving towards the last, the third salivary gland, that is sublingual gland. So sublingual gland is the shortest gland among all the salivary glands, and it is located in the sublingual fossa of the mandible bone, and 8 to 20 ducts are emerging from this gland, and they will open into the mouth, into the floor of the mouth to release the saliva. If I talk about blood supply, so blood supply is through submental artery and the sublingual artery. Submental artery is a branch of facial artery, and sublingual artery is a branch of lingual artery. Okay, and nerve supply is similar, same like submandibular gland. Okay, submandibular gland की nerve supply क्या है? Submandibular ganglia, and that submandibular ganglia, the branches of the submandibular ganglia is also supplying to the sublingual gland. There is a mucus cyst. Mucus cyst क्या होता है? एक एलिवेशन, एक पूरा का पूरा स्वेलिंग हो जाती है, ठीक है ना. तो the mucus swelling is common in sublingual gland, because as sublingual gland consists of high mucus content. If I talk about submandibular gland and parotid gland, so among all the salivary glands, sublingual gland consists of high amount of mucus content. That's why there are many chances of mucus cyst which is formed in the sublingual gland. So you have to remember these all things. Till then, work hard, study hard, and good luck. Take care. Bye bye.